We're here today to talk about integrative psychotherapy and the integrative psychotherapy program and the workshop that we will be organizing in August. To start off with, could you explain us a bit more about what integrative psychotherapy is?
So I think one of the problems with psychology as a field is that it consists of all of these different areas of study and different schools of psychotherapy. So you have neuropsychology, evolutionary psychology, developmental psychology, social psychology, cognitive psychology, and then you have clinical psychology, and then within the clinical field you have all of these different forms of psychotherapy. You have the cognitive behavioral approaches and psychoanalysis and experiential approaches and body-oriented approaches. And these different schools of thought and these different fields of psychology are never really integrated well. And one of my professors once said that, if you look at the field of psychology, it's like confetti. So you have all of these fascinating and beautiful, colorful theories and ideas and research papers. But then when you look closely, you find that it actually consists of all these fragmented pieces, and there's not really a coherence between them. They're never really integrated well. And this actually causes a lot of problems because you get people reinventing the same wheel, people providing old wine in new bottles, right? So because no one really pays attention to what the others are doing. So I think that's a major problem for the field of psychology, the lack of integration. And then as a psychotherapist, you're bombarded with all of these theories and approaches, and you have to figure out for yourself, what am I going to choose? Am I going to become a cognitive behavior therapist, or am I going to become a family therapist, or am I going to become a psychoanalyst? And besides picking what forms of therapy you're going to do, you're also going to have to figure out how to put all of those ideas together and then how to apply them in clinical practice. And I think that's a very difficult task. And all of us psychologists are asked to integrate our knowledge and our these different pieces of theories and techniques. I think everyone is essentially an integrative psychologist or integrative psychotherapist if you're doing clinical work. And everyone has to figure out for himself, how do I fit together those different ideas? And what we're providing is a collection of frameworks that allow you to integrate as much of these different ideas and theories as possible.
Right, to bring it all together, to be the substance between all the confetti that connects it and makes it into one integrative, comprehensive framework, into one whole.
Right. And I often use the story of, it's a Buddhist story, but it's also in Hinduism, of the blind man being confronted with an elephant for the first time, and each of the blind men touch a different part of the elephant. So one blind man touches the tail, and another one touches the foot of the elephant, and another one touches the head. And then they're asked to describe what an elephant is like. And they each have a different description of the elephant because they touched a different body part. So the person who touched the tail of the elephant describes the elephant as a kind of rope. And then the person who touched the belly of the elephant describes the elephant like a big wall. And then the person who touched the foot of the elephant describes it like a tree trunk. And then they start fighting because they cannot agree on what an elephant is like. And then in some versions of the story, they realize their mistake, and then they conclude, okay, actually we need to bring together our ideas to get a complete picture of the elephant, But people who only have one side who only have like a one-sided view of reality, they end up fighting each other because they cannot make up, they cannot realize that each of them have a different aspect of the full picture, let's say. And the different areas of psychology are studying the same animal. We're all studying the human mind in all its variety. And we all have different pieces of the puzzle. And I think we need to figure out how they fit together to get a more complete picture. And I think that's what we're trying to do, to figure out, if you put all of these pieces of the puzzle together, what is the image that you're gradually getting. And yeah.
Right. I was also thinking, as you were talking about the ways in which psychotherapy and the different schools of therapy and different schools of psychology, the empirical sciences, like how they are disconnected and kind of fragmented. It also made me think about the diagnostic system of, well, you know better how many diagnoses there are in the DSM-5 now.
Yeah.
But there's like, you also need to decide, besides which school am I going to do and which theories am I going to apply and which techniques am I going to use. You also need to decide which clients am I going to work with and where does this specific problem, where does it fall, which diagnosis is that?
Yeah. There's a proliferation of information and ideas, and it only gets more and more. So there's like a constant branching out of information. So you had psychoanalysis, and then within psychoanalysis, you get all of these different approaches, these different schools of psychoanalysis. And then you get cognitive behavioral therapy, and then within cognitive behavioral therapy, you get all of these different, forms of cognitive behavioral therapy. So there's a constant, like more and more forms of therapy are developed, more and more theories are developed, but there's not really any attempt to, well, there are some attempts to integrate it, I must be fair, but there's not a very clear movement towards bringing everything together and trying to see how everything fits together, because it's so much, it's way too much. Just reading about psychoanalysis in its entirety is already too much. Like there's so much published only within psychoanalysis, let alone cognitive behavior therapy, let alone developmental psychology. Like it's way too much. But I think we get a more interesting picture if we try to bring together as much as possible. And it's not just difficult because it's too much, but it's also difficult because it's often contradictory. So these different fields of psychology and these different schools of psychotherapy, they often contradict each other. And it's difficult to bring together theories that are opposing to each other. But I think that's where you get the most creative ideas, when you try to bring together ideas that are opposite to each other. And I think when you try to do that, you make up for the blind spots of each of these different approaches. So psychoanalysis is very deep and very rich. It has some problems with jargon. It has other problems as well, but it's undeniable that psychoanalysis has a very rich and very deep understanding of the human mind. But they sometimes go so deep that they neglect the surface, and they neglect to help the client actually reduce their symptoms. So then if you look at cognitive behavior therapy, they focus a lot on symptoms, and that lets figure out the fastest way to treat these symptoms. But then they lose a lot of the richness and the depth of that psychoanalysis had. And then they fight with each other because they're so different. But I think when you try to bring them together, you have both. You have the treatment of the symptoms and you have the depth. And I think you get a more comprehensive and more useful psychology if you are able to use both of them.
Right. And besides psychoanalytic, psychodynamic, and cognitive behavioral schools, what other major schools are you bringing together in integrative psychotherapy? What are the most important ones?
I think the four major schools of psychotherapy are psychoanalysis and psychodynamic therapy, cognitive behavior therapy, and then the humanistic and experiential approaches. And I would also put the body-oriented approaches there. And then you have systemic approaches, family therapy, systems theory, couples therapy as well. And then if I had to pick a fifth one, I would pick trauma-focused approaches. But within the trauma-focused approaches, you have the body-oriented approaches and the more cognitive behavioral approaches. So I'm not very sure if that should be seen as something separate. But I try to look at all of those. And I also try to look at empirical approaches, so developmental psychology and evolutionary psychology as much as I can. And but of course there's overlap because there are approaches that fall within multiple categories. I mean, schema therapy is probably already by itself an integrative form of psychotherapy that has cognitive behavioral aspects and experiential aspects and psychodynamic aspects. But I think it's best to look at as much as possible. But there are some areas that I don't pay attention to. So I don't really look at spirituality and religion within my frameworks, which doesn't mean that those areas are not important, but I have to choose what to include and what not to include. And if I were to include spirituality or religion, I would probably alienate a lot of my clients who are atheists or not very spiritual. It's also not very fitting for me personally because I'm not a very spiritual person. But other therapists may choose to include those things as well, or to include philosophy or existentialism. So there's not really a limit to what to integrate. It's more of an approach to psychology in general, and I think everyone needs to figure out for him or herself whether he or she wants to include even more.